us for today's media availability. I'm Michelle Bartlemay, a Public Relations Manager for St. Luke's. As a reminder, please mute your microphones and turn off your cameras for now. Today, we have with us Dr. Laura McGeorge, St. Luke's Health System Medical Director for Primary Care, Dr. Kenny Bramwell, St. Luke's Children's System Medical Director, Dr. Stephen Nimerson, Chief Clinical Officer for St. Alphonsus Health System, and Dr. Mark Naser, President of the St. Alphonsus Medical Group. So for today, the doctors on the call will provide you with some updates on COVID activity, testing, and kids going back to school. Then we will open up the call to these questions about these topics. When it's time, please raise your virtual hand by clicking the button and I will call on you. When you hear your name, unmute yourself, provide your name, news organization, and to whom your question is directed. You can also ask questions with the chat feature if you prefer. And as a reminder for those joining us, please mute yourselves for now and turn off your cameras. And with that, we'll get started with Dr. McGeorge.
Thank you. Thanks so much. So just a quick update on what we're seeing at St. Luke's Health System and probably is happening across the state. We are really, even compared with just a few days ago, we're really seeing an exponential increase in demand for testing. And I'm sure many of you are finding that it is difficult to find testing available. Most of that is due to the very high demand for testing right now. So we had gone from same day really or within a day turnaround, and sometimes even it can take several days to sign up to get a spot to get tested right now. So we're trying to work through that, and we'll continue to work on that as hard as we can. We do understand the guidance that's coming out of the CDC is to get tested, of course, and again, we're working as hard as we can to meet the demand, as are others in the community. We do have some limit from, there are only so many people that we have that we can put there to test, and also there could be some supply issues too with testing. I do want to emphasize and ask that, again, remind people, just like we had said earlier on in the pandemic, please don't go to the emergency room, urgent cares, or even your primary care doctor to get tested without primary care, check with them first, but definitely not to go to urgent cares and ED emergency rooms just for getting tested. They really are extremely busy right now taking care of patients, and we need to continue to keep those resources doing what they do best. If you have symptoms and are having a difficulty getting a test, then use your best judgment, but you should isolate and assume, I think, that you have COVID until you are able to get tested. Our hospitals continue to be very busy. A little over 10% of our hospital volumes are COVID related, although in the intensive care units, it's about 30% of our volume is COVID related. Volumes still are very high because recall earlier in the pandemic when we were in crisis standards of care, a lot of surgeries and other chronic care was delayed, and some of that is getting caught up now. And so volumes are very, very high. Plus, we are in winter, which is the time for influenza and RSV and the usual winter infections that happen. So our hospitals are very, very busy, some of which is COVID, but a lot of it is not. And the other thing I would add as far as hospitals go, our hospital employees and physicians are like everyone else in the community, and they too get COVID. And so we, of course, have quite a bit of numbers of people out due to COVID right now. Just a quick touch on CDC quarantine and isolation. A lot of that has changed in the last week or two. It's complicated. We can give you some links from the website. Ideally, again, it's still ideal to have 10 days of isolation if you have COVID, 10 days from start of symptoms, but it is acceptable to just have the 5 days plus either an antigen test, or if you can't get that, what I call extreme caution, which would mean using a well-fitting mask, avoiding places where you have to take your mask off, like eating indoors restaurants. We can continue to support our local businesses by getting takeout, and there are ways we can support but still keep our communities safe. Again, boosters, we continue to emphasize boosters as the number 1, 2, 3, 4 thing you can do to minimize risk of becoming very sick from COVID, and remind people, please get your flu shots. We are seeing quite a bit of influenza, and just be safe, especially as Omicron is going through our communities. And that's our update, and I would like to toss it now to Dr. Nemerson. Thank you.
Thanks, Dr. McGeorge, and really pleased to be here with you all this afternoon. As always, our number one focus here is to try and make sure there's accurate information that's being shared with the public, and our communities are able to respond in their own best interests and protect themselves and the ones that they love. Our experience at St. Alphonsus Health System, very consistent with what's happening across the nation and what's happening at St. Luke's Health System. I'll give you some numbers in a moment, but I want to remind you first that at the beginning of the pandemic, now about 2 years ago, I made a comment that the COVID train was out of the station, and by covering our faces and by separating from one another, social distancing, we could turn that train around. Well, the train's coming back. This is very much like the beginning of the pandemic again. And this time it's going to flatten us, quite honestly, and we need to be prepared for that. And the same measures that we've been talking about for a long time are the ones that are going to protect us, but we recognize that some people are not going to be able to protect themselves because they're immunocompromised or the vaccine doesn't work as well in particular individuals. And also others will choose not to be protected. And so we're here to serve. The numbers that we're experiencing in the past 2 weeks have exploded. Fortunately, we're starting from a low level. We're calling this COVID surge number 5. COVID surge number 4, which really decreased significantly, ending approximately 1 to 2 months ago, not even. We at St. Alphonsus Health System got down to an inpatient COVID volume below 20. In the past 2 weeks, we've seen that number now escalate significantly to over 40, and today's number is 43. So that's a 100% increase in total inpatient COVID volume in 2 weeks. Consistent with that also, as Dr. McGeorge commented, the number of employed people on our teams that are getting COVID has also exploded. And this is in the context of having a little bit more flexibility and allowing people to return to work, because we've learned in the past year how to protect our colleagues from acquiring COVID in our facilities and protect patients and staff from spreading COVID to one another. So despite that, we had seen essentially single digits of employees 2 weeks ago that were on COVID leave, and now our number is up to 125. So we've gone from 14, to be specific, 2 weeks ago, single digits a month ago, and now 125 on COVID leave today. That's going to have very dramatic implications in our ability to take care of patients, obviously. And in a moment, I'll ask my colleague, Dr. Nasser, to talk about some of that. But the reality of the hospital situation then is going to be what I presented in previous surges: longer lines for care, longer time periods to be seen, fewer beds available, expansion of staff to take care of more patients. And in this case, if this trend continues, and we expect it to do so, we will be further impaired from accommodating the same number of patients we're able to take care of during surge number 4. So at St. Alphonsus Health System, we maxed out at about 170 COVID patients across all of our hospitals. And those of you who remember news conferences at that time will remember we were in the throes of crisis standards of care and risking triage and actual rationing of care, which never happened. I hope to God that that doesn't happen again, but I'm afraid it may this time because our resources are more constrained, our flexibility is less, and functionally that means we're going to be able to care for fewer patients. So we're likely to need to go into crisis standards of care sooner with this surge than we were in surge number 4. The last thing that I want to comment about is the effectiveness of the COVID vaccine. So I've given you a lot of very sobering numbers. I can give you more if you care to hear them, but what I want to talk about is the positive here. What we know is that on a per capita basis, despite this massive amount of Omicron spread, the number of cases that are converting into hospitalizations and death is fewer. So why is that the case? It's because people are vaccinated and boosted. And among our own employed medical staff, doctors, nurses, advanced practice professionals, technicians, and others, we have attained at St. Alphonsus Health System 100% compliance with our vaccination requirement. And in that context, compared to the community at large, those who are requiring medical care, even if they have a breakthrough infection, are much lower. And so we're able to keep our people working and taking care of the patients they need to care for. So big picture, very frightening. Little picture, we've done the right things to prepare for this as best we can, and we will continue to serve the community. And with that, I'd like to hand off to my colleague, Dr. Mark Nasser, president of St. Alphonsus Medical Group, to give you a little insight into the outpatient experience and some other things related to vaccination and testing.
Thank you, Dr. Nemerson. Thank you to our community partners and to all those on the call. I'd like to share that across St. Alphonsus Medical Group, we also are seeing a significant increase in patients presenting to our medical group, primary care and our urgent care clinics. A significant portion of those are presenting with requests for COVID testing, consistent with what you're hearing across the nation and across our state of Idaho and in our community. Compared to just 1 week ago, we're now seeing over a doubling of patients in volume presenting to our clinics requesting COVID testing. So now, just to be compared to a week ago, between 1 and 200 running tests per day, we're now averaging between 300 and 400 COVID tests per day across our group, and a very high test positivity rate, which is now approaching 27%, which basically means that of all the patients that are requesting to be tested, 1 in 4 is a confirmed positive test, reflecting the increased spread in the community. And I think that number is consistent with some of our health partners in the area, also seeing a large spike in that test positivity rate. And our urgent cares also are seeing significant volumes coming in, again, largely COVID related. We saw between 500 and 600 patients just yesterday in our urgent cares, which is a significant increase. And to Dr. McGeorge's point, we want to be cautious with our resources in the hospital and preservation of true emergency resources, emergency care resources for those patients who truly need them. So it's somewhat of a balance. In a similar manner to what's been mentioned or presented, we're seeing a direct operational impact on the ability to maintain our clinic staff and hours because of not only the demand, but because of the increased numbers of healthcare workers that have been exposed to COVID or are out sick on COVID leave. And so we suspect that also will drive increased numbers into our clinics and overflows that could potentially impact the emergency rooms and the hospitals. So we're similar to our partners in town, we're carefully evaluating decisions about appropriate staffing for our clinics and trying to be very thoughtful about how we can successfully and safely operate our clinics, and to what level we can do that based on community need and based in partnership with those on the call and other healthcare providers in the area to make sure that we can take care of our community properly. And despite all those challenges, the commitment of our healthcare workers as we start this new year in 2022 is a truly inspiring and impressive commitment to our community. And it's just an honor to continue to work alongside our healthcare professionals. So that's by way of introduction for our medical group. I just wanted to hand it over to my colleague, Dr. Kenny Bramwell, St. Luke's Children's System Medical Director. Thank you.
Thank you, Mark, and thank you, Stephen and Laura, as well. You know, these are tough times, and I'm afraid we have some challenging news to share with you today, as has been shared already. You know, one of the concerns we have, particularly within the view of the Children's Hospital and the pediatric population, is If you look nationally, there is a range between the numbers of inpatients doubling and quadrupling at many facilities. Many other facilities aren't necessarily offering numbers, but they're saying that this is the busiest they've been in the entire pandemic. You know, historically, Idaho has been between 2 and 5 weeks behind other parts of the country. So I expect that this will happen soon. It has not happened yet. I look at all of our patients who get admitted for COVID and try and figure out patterns and tendencies. We have 3 patients admitted with COVID today, and I think one of them is going home in an hour. So we'll then have 2. So we are not seeing the sort of very concerning numbers that have happened elsewhere, certainly not at this point. The other thing I wanted to touch on is the perfect storm that we have coming of the most contagious variant peaking at a time when many people are going back to school in the next week or so. Out of the 120 school districts in the state, I think 3 of them have mask requirements in place, and the other 117 either don't have anything or have never talked about it. And there are a few that have masks as optional, but by and large, masks are not required in most of our school districts. That's a concern when you have 20 or 30 kids in a room for 6 hours together with a very contagious virus. So what are the things that we can do as parents and as community members or as grandparents? You know, certainly we want to continue to emphasize the importance of vaccines. They've been shown to be safe. They've been shown to be effective. They've been shown to be phenomenally helpful in keeping people out of the hospital at all ages, recommended by the CDC. Masks are certainly helpful. They won't ever take the place of vaccines, and they won't ever really be as game-changing as the vaccines are. Masks are something we encourage, but we've been fighting a tough battle in getting these in place in most of our schools. So I am concerned about how that's going to go over the next few weeks. The other thing that we can do is encourage, you know, the distancing where it's possible and the masking where it's feasible. With that, I think those were the main points that I wanted to hit, and we'll hand it back to Michelle, and she can coordinate additional questions that you may have.
Thank you all so much for your comments. So it is time now to open for questions from our media partners. And as a reminder, you'll want to raise your virtual hand, wait until I call your name, then you'll unmute your microphone to ask your question, and you can address that question to whoever you see fit. So I will wait for some hands going up, and then we will go from there. Dr. McGeorge, do you have a question for yourself? No? Okay.
Well, sorry, that was a mistake. Sorry.
Questions from our media partners. Ian, I see your hand is raised if you'd like to ask your question.
Thanks, Ian with the Idaho Statesman. According to Health and Welfare, around 40% of positive tests that were sequenced by the state in the second half of December were Omicron and 60% were Delta. As I'm sure you know, the CDC estimates that during the last week of December, which is the most recent week they have data for, around 95% of COVID cases across the US they think were Omicron. I wondered if you all have thoughts on what the proportions are currently in the state between Delta and Omicron.
I'm happy to jump in. It's Laura McGeorge. So I think those of us who are on this call and, you know, practicing medicine in the community would estimate that we are mostly Omicron at this point. I mean, that is what we're seeing in the hospitalizations, again, starting to go up. A lot of people in the community sick, the demand for testing based on number of people symptomatic. I mean, this feels very much like the beginning of a big surge. And typically when we're seeing those big surges, or at least the last couple, have been change in variants, you know. So again, when Delta made its way to Idaho. That's when we really hit our biggest surge ever, and it's feeling like we're on the rapid upswing of a big surge here.
Thank you. And a quick follow-up, Dr. McGeorge. I don't think you mentioned this before, but apologies if you did. Does St. Luke's, do you have any figures for how many employees are currently out due to COVID exposure or illness or COVID-related reasons?
Yeah, I don't have exact numbers. Definitely, we do track those, and call outs definitely have been going up. Overall, I can tell you that they're about double what they were right before Christmas. A lot of those are related to COVID. I mean, there were some other issues, obviously, with people returning from trips and finding out that their flight was canceled because the pilots had COVID or whatever. So it's multifaceted, but certainly seeing a significant uptick in call outs.
Thanks.
Did anyone else want to respond to that question, the initial question from Ian, or should we move on to others?
This is Mark Nasser from St. Alphonsus. I would just echo the response from Dr. McGeorge that the rate of rise that we're seeing just day over day or week over week, although we don't have the daily ratio numbers on the typing of the virus, do suggest an increased transmissibility that is slightly different than what we've seen with some of the other curves, and that would be consistent with an increasing ratio of the Omicron variant compared to the last numbers that we had just a few weeks ago. So I think that clinically and consistent with other places in the country, that's what we're seeing here in Idaho as well. Thank you.
Great. Well, we will look for other questions from our media partners. So again, just raise your virtual hand if you have a question. Ian, without other hands raised, I say go ahead.
Okay, thank you. I guess I wondered if you could talk a bit about the supply of testing going forward. There's been a lot of discussion nationally about cities, especially in the East, having a lot of trouble with testing, running out of the numbers of tests that are available. Looking forward, what does the supply chain look like, and are there any resources you might turn to for more tests given the exponential increase that you mentioned?
I'll go ahead.
I can try from my perspective. Yeah. So definitely, again, I would like to reiterate exponential increase in testing demand, even from Monday. Big change. So it is really, I believe that it is very difficult to get a test right now. Again, we are doing everything that we can. I'm certain that other organizations are doing everything that they can to make testing available. Most of it is, again, related to the huge demand for testing. But some of it probably is supply chain issue, and again, some of it's staffing issue as far as the testing goes. So it is currently very difficult. Everyone is working as hard as they can to ramp up testing to meet the needs of the community.
I would add for those patients who are symptomatic, especially for those who are low risk, mildly symptomatic, that have the ability to obtain an at-home test. Perhaps if they're expressing symptoms, one of the rapid antigen tests might be available. I know that at different times over the last month or two, the availability has gone up and down on across the community for those to be obtained or purchased. And I understand that there's some initiatives to be able, on the national level, to be able to try to supply some of those. But that's another option for discerning if it is indeed a COVID exposure and a COVID positive test that patients can have at home. Definitely, if there's any complicating factors or increased risk for the patient, we'd want those patients to know that to come be evaluated in addition to getting the test at one of our clinics or health systems. But as at-home test availability becomes hopefully more available for lower risk, I think that's a great option for patients to consider.
Great, thank you. Appreciate your responses there. Sean, it looks like your hand is raised.
Yeah, hey, it's Sean Goldwyn with the Idaho Statesman. Might be slightly old news, but especially with the high transmissibility of the Omicron variants, just what type of masks and high quality masks would you guys recommend opposed to the typical cloth masks that we've been seeing for a while now?
I can take that one first. So Sean, thanks, excellent question. And we are recommending medical grade masks where available. Even in grocery stores now, you see a surgery-like mask. They're generally blue, and those masks are considered medical grade, generally speaking. The reason is that medical grade masks trap more of these very, very tiny particles that carry the virus. And so cloth masks, because of the microscopic gaps between the threads, don't do as good a job, and therefore getting those medical grade masks. And specifically to be most protected yourself, we're recommending something called a KN95 mask or an N95 mask. And those masks that are purchased from legitimate suppliers really do an excellent job of protecting you from acquiring the virus if you come across somebody who's infected.
I would just like to add on masking, that is completely agree with that, and just would want to add on again, making sure that that medical mask is fitting properly, that you don't want gaps. And so typically you'll pinch, there's a little wire, you pinch it around and you make sure you don't have any gaps. When we see people walking around with big gaps on the side or above or below the mask, then the mask is really not doing very much.
Great, thank you.
One last thing I'd comment on too, which is when you're in a situation where you're going to be in proximity to other people, so you're in some sort of group setting, a meeting, whatever it is, if everyone at the table is appropriately separated and wearing medical grade masks, you can feel pretty comfortable that you're going to be protected. If somebody at that table is wearing a cloth covering mask, then offering them one of the medical grade masks is very important. And then the other thing is you should be making decisions when you're in things like the grocery store, the bank, etc., to stay away from people who are not wearing medical grade masks. And obviously distancing is equally important.
Great, thank you. Well, we'll give just one more pause for any other questions. Ian, I see you're back. Go ahead.
Sorry, don't mean to take over. I guess two last questions. There was some news sort of when Omicron first started spreading that it was sort of crudely and easily identifiable on PCR tests due to some of the mutations in the strain. But then there was some news in December that due to an offshoot of that strain, there was sort of a stealth version of Omicron that was not as easy to detect. So I wondered if you're seeing in your testing facilities whether it's possible to spot Omicron easily or whether it has to be sequenced before you're able to tell the proportions. And then secondly, I wondered, this is probably for Dr. Bramwell, but I was wondering, you mentioned that Idaho hasn't seen yet the uptick in pediatric hospitalizations that other regions of the country have, but I was wondering, given the fact that Omicron seems to be in general cause fewer hospitalizations on an individual level than prior strains, is it known why it seems to be causing this uptick in pediatric patients?
I can take on the first question about the Omicron testing and what we're seeing. So I think, Ian, what you're referring to is the standard PCR tests test for 3 different parts of the virus. We call them 3 different domains. And the spike protein domain frequently with the Omicron will be dropped. In other words, the test won't pick it up. And so when we are looking at our test results for PCR tests and we see a drop S, it's called positive test result, meaning somebody's got COVID, but the spike protein is abnormal. Our suspicion that it's Omicron goes way up. However, that's not definitive, and so the only way to know the exact proportion that you're talking about is to actually have genetics sequencing done, which is done by the state lab and others, and so we don't follow that on a day-to-day basis. I think the most important message, though, for the public is that this rise in the number of COVID cases that's exponential and has occurred in the past 2 weeks is consistent with the contagiousness of Omicron and not with Delta. Delta, pretty damn contagious. Omicron, among the most contagious viruses known to man. And so we're experiencing that now, and that's what's going on in our communities. And then I believe Dr. Bramwell was going to answer some questions about kids.
Laura, did you want to go ahead?
Well, yeah, thank you. Just one other thing on that spike gene dropout on the testing and whether it's Omicron or not. I think a lot of you have heard that, recall during the big surge in the fall, we were really relying on monoclonal antibodies. And as we shift from Delta to Omicron, the Regeneron, which is mostly what was being used, although there was also another one, I mean, those are not going to be effective with Omicron. And we, I think, got a little bit spoiled and we're used to having monoclonal antibody just readily available. We had just a huge spike in monoclonal antibody use. Today, there is one monoclonal antibody that works against Omicron. Supply is incredibly limited for that, and so that will be very difficult. There are a couple of antivirals that just came out that I think a lot of you have heard about, but there are drug interactions. There are a couple of issues there, but generally very helpful medicines. But again, extremely limited number of those. So before, where we kind of had a rescue therapy somewhat easily available, that is going to be very, very limited right now. So again, all the more reason if you have, if you've been on the fence on getting vaccinated, now is really the time, because our rescue therapy right now in the outpatient setting is going to be extremely limited with Omicron. That's all. Thank you. And go ahead, Dr. Bramwell. Thanks.
Yeah, I'll try and answer the questions. It's been a few minutes now, so they're starting to fade in my head. But I think the questions centered on why are we seeing such an uptick in hospitalizations nationally? And I think it mostly has to do with the fact that Omicron is so much more contagious than the wild type, the Alpha or the Delta variants that have come before. So in the initial phases of the pandemic, you could hide or just not go around sick people or just not be in big groups, and many people didn't get sick because they were able to avoid the exposure. The challenge now is partially because of how we're behaving and because we have fatigue about behaving in those ways, which I totally get, and partially because this is just so much more contagious. That's the biggest difference, is this is so much more contagious than any of the other variants that we've seen, that if you are around this, it's very likely you're going to get it. So the best thing you can do is to expect that you're going to get it and to prepare as best you can. For me, that includes vaccination, and that's what I recommend to anyone who is considering it, is to get vaccinated even now. Go and start the series of vaccines to protect yourself and others around you. The other thing that we're seeing is that because Omicron is hitting so many people, and because it tends to be patients are contagious before they have symptoms, so they find out 3 days later, hey, that birthday party that we had, 2 of the kids had COVID, and there were 30 people in the party in the room. So that's the other challenge, is that it peaks early, the contagious component, and it's just in so many places right now that we're expecting to see more hospitalizations in contrast to prior waves.
Great, thank you. Any other questions? Last call. Okay, Well, with that, many thanks to our providers who've taken their time to give us comments and answer questions. And also thank you to our media providers for being here today. We appreciate your engagement. We look forward to the chance to connect again. That concludes today's session. Thanks so much.
Thank you.
Thank you.